the sportsmen? Is it the government? Please elaborate on that. And then another question to Dr. Amoth is regarding the projected number in September. The ministry has always said that September is the month that we will see a peak in Kenya. Perhaps if you can tell us if there is a new model that you're using to base on those numbers, and if you can also tell us those numbers. And also a further addition to what Sampaw has asked, is it a question of have you received more reagents, because we're seeing increasingly reduced numbers, now 193. You can also please elaborate on that. Thank you.
Sada Hassan from KTN. My question is on, you keep on saying in the last 24 hours you've tested these samples and you've seen this number of results. So we know for a fact that these samples are usually brought out together and then maybe a day or two, and then now the results are announced. So is there so these examples, these samples, when were they actually tested, and when were they collected? And then now the second question is, what measures have you put in place to ensure that we've seen a reduction in the backlog? Because across the country, we know that there's a backlog of these samples that have been collected. And we know in some counties that it takes up to 2 weeks to actually get the results. So, and by the time the results are coming in, they're not useful. Thank you.
Okay, thank you. There was a question regarding the 21-day strike notice that certain healthcare workers have given. As a ministry, our aim, especially during this COVID pandemic, is to ensure that our response to the COVID pandemic does not falter. And it will falter if the most prized element of this response, who are our healthcare workers in the front line, decide to down their tools. So ours is to appeal to our healthcare workers to be able to continue to render these important services at this critical time, but at the same time enter into dialogue on the grievances that they may have. And I can assure you that as a ministry, we are working together also with the counties and the aggrieved parties in trying to address these grievances. And there are discussions ongoing. The ministry will be putting it in its effort in trying to diffuse this situation and to avert this strike, because we cannot afford to have a strike at this point in time. And again, to our healthcare workers, it's not the right time for us to be able to engage in this type of unrest when we have serious concerns about saving people's lives in this pandemic. I will not comment on the issue of the COVID-19 billionaires, as you called it, because that matter is, I'm sure, receiving the attention of the right agencies and institutions that will be looking into it. So that is not an area that I would want to comment on. The reduced number of tests, and I think we have said before that first, the tests that we are reporting today are samples that were collected over the weekend, and generally we do see that following a weekend the number of tests are low. But having said that, we have in the last week been testing lower than what we had the previous week. And the reason is that it depends upon the supply chain and the reagents that we have. We do get these these reagents. We have organized to get it on a regular basis from our suppliers, and I think they have been able to maintain that over the last several weeks, that have seen our testing numbers really go up. But now and then we might have a challenge in this supply chain, and that is when you see us having lower numbers of testing. But we are expecting a consignment of tests anytime now, And as soon as that arrives, we shall still go back to our figures of before, or maybe even higher, as we continue with our testing. Alphas Langat. It is not only sports, I think, that wants to come back and be active. There are many areas within our social and economic life that we want to normalize and bring back to normal. Of course, in doing this, we must be informed by where we are in terms of our pandemic. And you have seen the progressive easing of measures as we have moved forward in some areas. And I'm sure that when the time is right and when we have the advice of experts as to what we can do in terms of the measures, those measures will be addressed at that time. And it's schools too. The discussion is around schools as well. Should schools reopen, and when do they reopen? How do we reopen? Is it going to be a phased process, and so on? As regards sports that will bring together a lot of people, gatherings in stadia, I think it still remains a concern. If we were to talk about soccer or things where you have a lot of fans coming into the stadium, we need to have the proper measures also instituted in that place. If we have to resume these sports, then we must also put in place the right measures to ensure that there is social distancing and wearing of masks and all these other procedures. I have seen this happen in other countries doing that. In many other countries, sports have resumed, but they are being done on a virtual basis, people watching from the comfort of their rooms. So I think we will address that as we move forward. The last 24 hours, when we say the last 24 hours of testing, which indeed what we mean by that is that samples have been collected, and usually they are collected. The program of collection of samples is that once they are collected, they are shipped to a lab. If they are collected during the daytime hours, they are then shipped to a lab in the evening, and then they are tested from there. Those are the 24 hours we talk about, because the following morning the results are ready to be presented. And by and large, that is how we have operated. However, on occasion, of course, there will be a backlog. And when there is a backlog, then preference is obviously has to be given to those samples that arrived earlier, for the reason that we need to test those samples. You can't keep samples for too long, otherwise they will not be of great value. So backlog challenges now and then do appear, but by and large, we do try to clear the samples that we get within that 24-hour period and return the results. And remember that we are testing in very many laboratories, and quite a good number of them are here in Nairobi, but we have also built capacity now in many of our laboratories across the country, in Kisumu, in Kericho, in Mombasa, in Kilifi, and then those results can then be relayed electronically to the center here for reporting. So I think that sums up the questions, but I will ask DG to say one or two words, perhaps.
Thanks, Waziri. In addition to what CS has told us, is that today morning we had a meeting with the Council of Governors, the Kenya National Union of Nurses, the Kenya Clinical Officers Union, and the Kenya Medical Practitioners and Dentists Union, in view of the strike notice that was issued. We have had very fruitful deliberations. Some of the issues date back to more than 5-6 years ago. And we have agreed that going forward, this is a time for us to come together as a country, and we'll be able to have a follow-up meeting next week on Tuesday to be able to see how we can be able to mitigate against this intended strike. So discussions are ongoing, and we are making good progress, and we believe we'll reach a compromise on the best way forward to safeguard the gains that we have made since we started fighting this pandemic in March. Lagat asked a question about the testing and the projections. Yes, as Waziri says, we have more than 34 labs now testing for SARS-CoV-2 spread throughout the country. But for the past 1 week or so, you have noticed a decreasing positivity rate, which as of today stands at 6%. So that is you are making progress, but you have not hit the magical 5%, which we need to hit and sustain for 2 weeks before we can actually say that we are flattening the curve. So our projections are in line with what we told you early in March, April, that the pandemic will peak in late August, September, and empirical data that we are seeing is pointing to that figure, but it is too early to conclusively come to address this matter as at now. So the next 3-4 weeks will be critical to be able to tell us whether we hit the magical 5% and we sustain that positivity rate for 2 weeks, in which case we can conclusively say that we have flattened the curve, and therefore we can be able to lift the remaining measures. The question regarding sports, we have worked very closely with the Ministry of Sports in development of guidelines and protocols to ensure safe resumption of sporting activities without danger to the sportsmen and women and also to the public. And some of these protocols will, of course, ensure that there will be no spectators or audiences in these sports, but people can be able to watch virtually through TV broadcast or through the internet. Yesterday you watched the Champions League final in Lisbon, which was a virtual thing, and we all watched it all over the world. We can as well be able to do that in Kenya, in athletics, in football, and all other areas of sports where we'll continue to excel. Thank you.
Thank you.